Yeah, we can see it.
Так, как проверить? This one. Okay, now where is так, where am I? Now, yeah, we discussed about cardiac and vasomotor centers effects. Yes, they increase heart rate and vasoconstriction. I hope you remembered about cardiac output effects. Causes widespread vasoconstriction, and we discussed, yes, we need vasoconstriction to increase our blood pressure, and this how they raise blood pressure and restore normal perfusion in the brain. Okay, here all effect of this reflex. That's our medulla oblongata decide, okay, we have ischemia for the brain. Only 4-5 minutes for brain, it's enough to die of brain tissue. Okay, that's why we have this special ischemic reflex for the brain. We haven't, so this reflex is for the kidney or for the heart or other organs. We doesn't need it because the main organ is brain. And after the 4-5 minutes, our brains will die. That's why our body decides that vasoconstrict vessels everywhere, because more important oxygen here is to the brain. Okay, this one idea of this reflex. And other brain centers and also other brain centers can affect vasomotor centers. For example, stress, anger, arousal can also increase our blood pressure. For example, it's due to this, it means not only ischemic reflex working, not only decreasing of oxygen in our brain activate increasing of blood pressure. If you feel stress, anger, or arousal, it also activate our cardiac and vasomotor centers, send sympathetic signals, and we have increased blood pressure. This is how exactly our blood pressure increased in stress situation. Yes, well, that's why patients mostly have stroke or infarction after the stress or anger. This this why also one of the treatment of hypertension, yes, and preventing this stroke and infarction, we telling the patient be calm, don't have stress. Okay, because we know the effect, how is this blood pressure increase normally, physiologically, okay? And if you have some relatives who have hypertension, you should know about this. Don't forget this. Так, next one. Hormonal. Так. Вот это вот убрать надо. Okay. Hormonal control. And we have 4 main hormones that vasoconstrict our vessels. For example, here you see hormones influence of blood pressure. We talk about the blood pressure mostly today, and it's some through the vasoactive effects, vasoconstriction, and some regulate water balance. You will discuss about this water balance regulation more detail when you discuss the urinary system. You will back for these hormones again and again, guys. And one of the main is angiotensin 2. This is a vasoconstrictor. Angiotensin 2 that's secreted in our body increased blood pressure directly. Maybe you heard about renin, angiotensin, aldosterone system, RAS. Do you heard about this one?
No.
No.
Yeah,
No.
you will discuss about this when you learn about the kidney, because renin, angiotensin, aldosterone, it's 3 hormones. This here again, you see aldosterone, we can see. Aldosterone promotes natrium and water retention by kidneys and increase blood volume and pressure. It's, for example, if angiotensin directly was a potent vasoconstrictor. And we discussed earlier that blood pressure, we can increase blood pressure by vasoconstriction or by regulating water balance. For example, oppositely, if we constrict our vessels and we have normal water balance, our blood pressure increased. If we, for example, dilate our blood pressure or vessels, blood pressure decreased. Or, for example, dehydration, if we have dehydration and water balance will be decreased, we have also decreased blood pressure, okay? Two mechanisms. If we have some changing in one of this, our blood pressure will be changed. And first, angiotensin is vasoconstrictor. If we activate angiotensin, we have increased blood pressure. Aldosterone regulate blood pressure due to water balance because of increasing blood volume. How exactly? He promotes natrium and water retention in the kidney. This is how his effect work. And we have renin, angiotensin, aldosterone system. Renin is hormone that's secreted in the kidney. Our kidney decide we need to decrease or increase our blood pressure, and he activate angiotensin to vasoconstriction, and he activate aldosterone to increase blood volume directly. This is how our blood pressure increased by RAS. Renin start or directly easier kidney can control our blood pressure. Okay, it doesn't matter to memorize this system right now, but in the future, when you read about the kidneys, you again read about RAS. You should know, okay? Next one, atrial natriuretic peptide. This one increase urinary sodium excretion. It lowers blood pressure. This one, reduce blood volume and promotes vasodilation. Okay, this atrial natriuretic peptide. Atrial, you should understand, is located somewhere in the heart, yes, near the atrium. And in the heart secretes this natriuretic peptide, which decreased our blood pressure through the vasodilation and reducing blood volume directly in the kidney. 2. Antidiuretic hormone promotes water retention and raises blood pressure. And pathologically high concentration of vasoconstrictor too. And we know about epinephrine. Norepinephrine, it's directly sympathetic system. It's constrict our vessels. It means it's increased our blood pressure. When our epinephrine and norepinephrine binds with alpha adrenergic receptors, we have vasoconstriction. You remember, yes, we said that some sympathetic controlling changeable in different areas. For example, in the muscles, they have sometimes another effect. It's connected with the receptors. If it binds with alpha adrenergic receptors, we have vasoconstriction. If they bind with beta adrenergic receptors, we have vasodilation. Mostly in the skeletal and cardiac muscles, blood vessels. Okay. Next one. And yeah, we discussed about renin inhibitors and drugs used for treat hypertension. Here you see renin inhibitors treat hypertension because of this mechanism. Yes, because I said before, RAS system, when renin activate in the kidney, it's activate angiotensin and aldosterone to these hormones, and our blood pressure increased. And oppositely, if we need to treat our hypertension, we need to block this RAS system. This is why we inhibit renin, and this is how we decrease our blood pressure. Okay, some of the drugs for treating hypertension can affect to angiotensin only blocker, for example, or aldosterone, or maybe antidiuretic hormones. It's changeable. Different drugs have different effects. Maybe some drugs or diuretics, for example, they affect only for the water balance, and due to this water balance changes, they decrease our blood pressure. Or someone maybe activate only vasoactive effects for maybe they inhibit some receptors, for example, alpha-adrenergic receptors. That's how they leads for vasodilation. Maybe it's changeable. Okay, guys.
Okay.
The idea is this: why you need to know them. I said you, no, I didn't say, but to be honest, I finished my university maybe some 5 years ago only. And I remembered, I understand you, and I think when you read physiology or anatomy, you should understand what for you do it. And for example, your knowledge in hormonal control or understanding of ischemic reflex will help you to memorize this information if you know what for you need it. For example, if you know hormonal control, you will understand pharmacology in future. It will be easier for you to learn pharmacology. Or for example, medulla ischemic reflexes, this also will help you to understand treatment. How you, it's this knowledge, guys, this, if you understand it correctly, it will increase your clinical thinking. Do you know the clinical thinking? What is it?
Maybe.
Clinical thinking. Yeah, it's fine. No, mind that it's important for medical students, for doctors, yes? It's ability for connect information that you take from the patient. Because mostly if you listen to the patient, the patient have so many symptoms, headache, finger, he has a cutting or something else, and so many symptoms can be in one patient. But if you know physiology, normal physiology, if you know normal anatomy, if you know normal anatomy physiology, you will understand the pathophysiology, pathanatomy, and you can understand what exactly happened. You can connect symptoms with together for syndromes, for understanding syndromes. Syndromes, it's collection of the symptoms that connected with one symptom or one system, for example, respiratory system, kidney system, or vascular system, doesn't matter for one system, or that connected with one disease. You will, it's why you know you use your knowledge for connect the symptoms. And after that, you understand what happened exactly with this patient. And after that, you can treat it. And also you treat it by your knowledge of physiology. If you know, okay, this patient was, you should decide, for example, do this patient have hypertension, or maybe he have only stress, and after that his blood pressure increased only one time, and he doesn't need some drugs. You understand it by using your clinical thinking. For example, if you go to doctor and for you came some patient with blood pressure increasing, for example, young woman, yes, 32 years old, and you see her blood pressure higher, you will think before they give him her hypertension disease, yeah, you will ask her, what happened before this? Maybe you have some stress, maybe some anger. And she said, if you don't know physiology, you don't know about these reflexes, you don't know that brain centers have effects, connection with emotions too. Yeah, if you don't know it, you decide, okay, you sit 32 years old and I give you some drugs, and after that, if she haven't hypertension, by using your drugs, her blood pressure will decrease and she will sick after your treatment. Do you understand this? But if you know about these connections, you understand, okay, she haven't the hypertension, she not sick, but she have some stress. And you said, okay, you doesn't need the drugs. You need only be careful, don't feel stress, be calm, and etc. etc. Okay? But if you give some unnecessary drugs for the patient. After using your drugs, it's not vitamins, the drugs, they will have their own effects. And for example, the normal blood pressure will decrease for low one. And after that, she will feel some nausea and other symptoms, and again came for you and say, what happened with me, and etc. Okay, understanding my idea, guys?
Yes, teacher.
Yeah, we get it.
Yes, ma'am.
Yeah, that's why you should understand. Okay, every time when you read something in physiology and anatomy, you should think firstly, ask yourself, why is they have this effect? Why it happened? And after you answering for this question, you memorize, your clinical thinking start to think. And in this next year or in the fourth year, when you start to learn therapy, gynecology, and etc., your clinical thinking working, you start to understand, okay, maybe this happened, or maybe this hormone's not produced in this body, or maybe she drinks some drugs and this happened. Okay, this normal anatomy, physiology, it doesn't matter that you read one time and forget it. No, you should start to produce your clinical thinking right now in the first year. Okay, after that it will be easier for you. Next, we can continue. Okay, two purposes of vasomotion. This part of this topic is also about the clinical thinking, because it's collect everything what you read before to show you how exactly it's affect for our body. For example, general method of raising or lowering blood pressure through the whole body. Increasing blood pressure requires medulla vasomotor center or widespread circulation of a hormone. And it's important to supporting cerebral perfusion during the hemorrhage and dehydration effect. Yeah, it's again, yes, the idea of high blood pressure, when we need the high blood pressure to our supporting cerebral perfusion. Так, ой. What we need to, we have rerouting blood from method, rerouting blood method. It's how we discussed before, this idea why we have increased blood pressure in this reflex, medulla ischemic reflex. Here we have vasoconstriction everywhere except the brain. This is the one of the example of rerouting blood. For example, when you do, also I start to discuss, I think in the previous lecture, yeah, do you remember when we said, when we're eating, our blood goes to the intestine mostly, and you want to sleep after that? Or yeah, if you eat something, you think that you want to sleep, and I said if you feel sleepiness, you need to stand up and walk some few minutes, and after that you wake up. Do you remember this one?
Yes, teacher.
Yeah, this is rerouting blood method. For example, during the exercise, how it's working? Yeah, during the exercise, you need more oxygen for your muscles, and your sympathetic system reduce blood flow for kidney, for digestive tract, for intestine, and increase blood flow for skeletal muscle. Because you need to do exercise, your skeletal muscles need more oxygen than digestive tract, for example. Or oppositely, metabolite accumulation. For example, or opposite, for example, when you're eating, the sympathetic system reduce the blood flow into the skeletal muscle, but give more oxygen, more blood to digestive tract. Where is it? Here, in this picture, for example. We can see this is aorta. Maybe you don't know about this. Yeah, aorta is descending part of the aorta, abdominal part mostly, and the end of the aorta is two common iliac arteries. These two common iliac arteries go to the lower limb. This one. This is superior mesenteric arteries, the great artery that goes mostly for intestine. 80% of intestine it's supplying by superior mesenteric artery. And here, this one, this one. For example, when we need to eat something, we need more oxygen for superior mesenteric artery. Our vasomotor center constricted all other arteries. For example, in the leg, you see reduced flow to the legs, constrict common iliac arteries. And all blood goes to the dilated artery. Okay, here. For this why it's not go to the constricted arteries, most part goes to the dilated artery. Here it will be superior mesenteric artery. This is why we increase for flow for intestine. Or oppositely, when we need to do some exercise, here our common iliac arteries will be dilated, our superior mesenteric artery will be constricted, and all blood go to the legs for do some exercise. Here, what again, yeah, localized vasoconstriction, how it working. If a specific artery constrict, the pressure downstream drops and pressure upstream rise. And here, it's again one idea. The most idea here that blood follows the path of rest resistance. And here we can see it. Less resistance we can see in dilated artery. This is why we have more blood flow in intestine. Again, here in this second situation, we have more dilated, less resistance in the common iliac artery. This is why they go to the no, when you do some exercise and you feel pain in the kidney, maybe, what do you mean? Can you tell me right now? Maybe after 1 hour, not in the kidney. Sometimes you feel pain in the intestine in one side, left or right side. It's not the reason. I think it's mostly about ischemia in the muscle, not ischemia, напряжение, wait, I forget the word.
Tension in the limbo muscles.
Pressure teachers miss напряжение.
Muscle tension. More tension in the muscles, and you feel pain somewhere in the back or somewhere in your abdominal part. It's not inside, it's not intestine, it's not in the kidney, it's muscle. For example, you never feel, you haven't neurons for pain in the kidney. Inside the kidney, you haven't some neurons. It's again, you haven't neurons in the vessels inside that give you afferent signals about the pain. Okay, you haven't. We have, for example, in the vessels, we have signals for contraction, dilatation, but never for feeling pain. The same with, we haven't these signals for kidney, for liver, for example, we haven't it. We start to feel pain only when some inflammatory process affect for another outside neurons, vagal nerve or muscle nerves, for example. In muscles, we have this, or in some, mostly in the muscles one. And for example, if you do some exercise and if you feel pain, it's your muscles, not kidney.
Okay.
Так, okay. Кто это? Sometimes when we sit, guys, you can speak with me. Don't write. It's not necessary to write in the chat. If you have some question, you can ask right now. I have for example? What you asking?
Sometimes when we sit for a long time, we feel that like numb in our feet. That's because they're reducing on the flow.
Yeah, because for example, when you're sitting, you press your arteries, femoral artery mostly, and you feel some ischemia. It means you press artery in one position. For example, right now you're sitting, and your leg pressed by your sitting, yeah, during this one. And after pressing, it means less oxygen goes to the legs. Or maybe another way, maybe your nerves press too. It's also give pain. But if we're talking about the vessel, they can be pressed too, and it will be ischemia for your leg, and ischemia also give pain because of metabolic. Do you understand? Yes, if you have ischemia, it means more CO2 or more metabolic metabolites, lactate, for example, produced in the leg, and this one increase CO2, lactate, and another metabolites start to affect for neurons inside the muscle, and these neurons give signals to the brain about the pain. This is why you feel pain and you need to change your position. Okay, because of neurons activating, because of metabolites, but not never but because of vessels themselves. You can feel it. You feel only some effects for neuron system. Okay, it's complicated thing. Okay, but never forget that we never have neurons inside the vessel that give signals about the pain. No, it's efferent signals. We discussed about it. Efferent signals, if you remember, that goes from the organ to the brain. We haven't efferent signals in the vessels. We have these efferent signals only in the baroreflex, for example, or hemoreflexes, special areas that can give some signals from the vessel to the brain. But other part of the vessels, other arteries and veins never have these efferent signals. That's why we can feel pain if something happened in the artery. Or, for example, if you cut finger, you feel pain not because of bleeding, not because you cut your artery or capillaries, because you cut your nerve that located here near the vessel. That's why you feel pain. Understanding?
Yes. The pain comes from the nerve.
Yes.
Hmm?
The pain comes because of the nerve, right?
Yeah, because of the nerve, not because of the vessel. But all nerves located near the vessels. That's why if something happened with tissue near the arteries, yes, we can feel pain because of the nerve, not in the vessels. Так, here. Так, just a second. How much time we have?
1 hour, I think, teacher. Yes,
Just a second. Sure. No, yeah. Afferent, yeah. Так, now we can see, guys, I have mistake. Yes, we have efferent arteriole. I changed it. Efferent arteriole or efferent neurons that give signals from the brain to the vessels. We have an afferent arteriole, afferent nerves. afferent signals that go from the organ to the brain. We absent here, we have absent afferent signals from the vessels, okay? We have only efferent that goes from the brain to the vessels, like sympathetic system, but they not go opposite to the brain, except our baroreflex and hemoreflexes. Baroreceptors and hemoreceptors, special, yes, areas in the carotid arteries and in the aortic arch. Okay? Так. This one. Do you understand this?
Yes, teacher.
Yes.
This picture, very. This picture, this about the blood flow again. Who take? What? Someone came to the lecture connected. So this question, it's also connected with the nerve system because of nerve centers that we have in the abdominal area. Okay, it's not connected with our topic. It's not connected with the vessels. What you can ask? Denise, Saad, you take hand.
Yes, I have one question about pain of intestine or organs. I know the organs covered by fibrous covering, fibrosная оболочка, but I don't know, is it also innervated or not?
Fibrous tissue? In which organ you mean? Denise.
Kidneys or liver kidneys?
Fibrous tissue in the kidneys, yes, they have neurons. They have, but you asking about the what? Can you repeat? What exactly about fibrous tissue you want to know?
In case in where we have
I can't hear.
Me too. Connections so bad.
Can you repeat again because I didn't.
I want to ask about they are innervated, but could the tumor of kidney tissue causes a pain via fibrous covering?
Okay, yeah, we have fibrous tissue in the kidney, for example, and if we have tumor, you can't feel pain also. You feel pain because of pressing this tumor inside the kidney, another neurons located near the kidney, or for example, if they press another organ and they start to feel inflamed or block, for example, blocking vessels near the kidney by this tumor. After that, you feel pain somewhere, but you can't feel pain inside the kidney. Fibrous tissue also haven't afferent innervation. They never give signals to the brain about something happened in the kidney.
Okay. Okay, thank you.
You should understand efferent innervation and afferent innervation. Yeah, efferent that goes from the brain to the organ, doesn't matter, and they give signals for the for example, that we discussed before, yeah, about the sympathetic symptoms or sympathetic innervation or nervous vagus. They efferent. They go from the brain to the organs and give some signals. Afferent, it goes oppositely from the organ. For example, if you feel pain somewhere, yeah, it's afferent. It goes from the organ to the brain. In some organs, if they haven't this afferent innervation, you will never feel something happened in this organ, like kidney, vessels, also liver. Okay. It's about innervation, and you will learn it in the nerve system, more detail. And after that, you understand it. Okay. So why the briefing? Again, about the briefing, guys, about it's mostly in the respiratory system. All these things, yeah, I agree, they say connected, but it doesn't mean that you must understand everything here. Today's you should understand only how exactly blood flow working, okay? In some different areas. For example, this picture, you show your differences about the rest, about changing about in the circulation. For example, how we said, yeah, we said this rerouting blood. And again, in this picture, you can see when you rest, your total cardiac output is 5 liters per minute. And this is percentage how exactly your organs vascularized. Muscles 20%, digestive 27, renal 22, cerebral it's 14, for example, cutaneous, coronary, and other. You see, it's when you rest. But when you do some exercise and you need more oxygen in for your muscle, it's changed. You see, 70% of this of your cardiac output and also cardiac output increased. Yes, because we know our heart rate increased, our blood pressure increased. This is why cardiac output increased too, if you remember. And also vascularization increased for 71, and other one will be stable, decreased. And on the cerebral, if you think that it will be stable for 70 milliliter per minute and 700 milliliter per minute and 750 milliliter per minute. Cerebral will stable every time. Others will be decreased. Так. Next one. Now we have 50 minutes, and we have another second part of the topic. It's capillary exchange. Capillary exchange, it's connected. I hope you understand all types of capillaries. And here, do you have another questions about blood flow responses? About changing vasoconstriction?
Let's, I think, move on to next topic to not lose time as in the last year lesson. And then maybe if you have questions, let's discuss all the questions in the end.
Okay, go. Capillary exchange. The most important blood in the body is in the capillaries. It's only 250 or 300 milliliters, only 5% of total, but is the most important because of capillary exchange, because all function of vascular system is deliver our oxygen, and oxygen CO2 exchange happen in capillary. This is why it's the most important part of vascular system. And we have two ways of movement of fluid across capillary walls. Exchange made by the blood surround tissue. It's water, oxygen, glucose, amino acids, lipids, minerals, antibodies, hormones, waste, carbon dioxide, and ammonia. These things will change, cross capillary wall during this exchange. And here, we have 3 roads for capillary exchange: through the endothelial cells cytoplasm, through the intercellular clefts between the cells, and filtration force in fenestration capillaries. 3 mechanisms, or three roads, sorry. And each of these 3 roads have 4 mechanisms: diffusion, transitosis, filtration, and reabsorption. filtration and reabsorption mostly for the fluids, and diffusion and transitosis mostly for the other structures. Так, это again. Here, first mechanism is diffusion. Diffusion is the net movement of particles from a place of high concentration to a place of lower concentration as a result of their constant and spontaneous motion. And this is more important for glucose and oxygen. For example, glucose and oxygen more concentrated in the blood, and that's why they diffuse for tissue, because in tissue they less. Or opposite, carbon dioxide and other waste, they more concentrated in the tissue. That's why they diffuse for the blood, because in the blood the concentration of carbon dioxide less. Так. Yes, the solute can permeate the plasma membranes of the endothelial cell, find the passage large enough to pass through filtration pores intracellular cleft. This is how exactly diffusion working. And we have lipid-soluble substances like steroid hormones, oxygen, CO2, and they diffuse easily through the plasma membranes. And we have water-soluble substance like glucose, electrolytes, and they pass through filtration pores and intercellular clefts. Okay, two ways for diffusion: plasma membrane and intercellular cleft. And you should know which structure will go through which way. And also we have some large particles like proteins, but they can't diffuse. They held back. Next one, understanding this one, diffusion, I think it's easy.
Sure.
And next one, it's transitosis. Trans means across, cit it's cell, osis it's process, yeah, and it means across the cell. And the meaning of transitosis is when endothelial cells pick up material in one side of the plasma membrane and pinocytose it, like here. This is one transitosis. And it's go transport vesicles, form vesicle and transport vesicle across the cell and exocytose it in the other side. Examine out, cit cells and process again. We say pino, for example, pinocytosis is drinking cell process, we can say it. Endocytosis, into cell process, goes inside the inside the wall. And exocytosis, it go out the cell. We get three processes through the transitosis: pinocytosis, endocytosis, and exocytosis. You should understand these three terms. And this transitosis is important for fatty acids, albumins, and some hormones like insulin. Yes, because they big and they can go through diffusion. That's why they have special way transitosis for them. In this picture, you can see again all this process. We use phagocytosis like one to produce visual pinocytosis. Here you can see how it's working, and receptor-mediated endocytosis. Again, we can see vesicle, it go through the cell like this one, and we have exocytosis in another side. This is understanding, yes, it's capillary inside lumen. This is tissue. This is erythrocyte. Yeah, okay. And here we can see capillary endothelial cell. This is lumen. This is tissue again. This is intercellular cleft. Here we can see pinocytic vesicles. This one, this one. Here they go out. This is tissue fluid, and this is muscle here. And we can see here, we can diffusion. Here we can see transitosis. Next one, the last one. And if you remembered, I said filtration, diffusion, and transitosis is for some substances like hormones, oxygen, or other things, lipids, and other. But for the liquid, we have different ways: filtration and reabsorption. And filtration is the process in which physical pressure force fluid through a selectively permeable membrane. For example, here in this picture, we can see capillaries. Selectively permeable membrane is all allows some things through, such as nutrient waste, but usually prevents other things, such as proteins and phosphates, from entering or leaving the cell. And filtration seen in the blood capillaries, where blood pressure forces fluid through gaps in the capillary wall. Mostly, filtration is for the liquid. And here, this is important. Fluid filters out of the arterial end of capillaries and osmotically re-enters at the venous end. Okay, here if we have capillary, this one will be arterial end, this one venous end, and here in this part we have filtration. Here we have reabsorption. In filtration, fluid goes out of the vessel. In reabsorption, it goes back to the vessel from the tissue. And here we must know the osmosis and hydrostatic pressure. What is it? And here we have opposite two forces. Blood hydrostatic pressure that drives fluid out of capillary, and it high in the arterial end of capillary and low in the venous end. And we have COP, colloid osmotic pressure, that draws fluid into capillary. And oncotic pressure, it's connected with the proteins. For example, if we discussed about hydrostatic pressure inside the vessel, it's the same with blood pressure. It means blood pressure inside the capillaries is calling blood hydrostatic pressure. And hydrostatic pressure, you see, it's force, physical force exerted against the surface by a liquid. Okay, easier to understand. It's hydrostatic pressure, it's blood pressure inside the vessel. But colloid osmotic pressure is connected with the proteins. And here, mostly it's albumins. And for example, colloid osmotic pressure will be higher inside the vessel because albumins more in the vessel but less in the tissue. Easier, we need to go for this picture here. This one. You will find this picture in the book. And here we can see this is arteriole, this is the venule, and this is capillaries. Blood flow goes from arteriole through the capillaries to the venules. Here, how net filtration work in the arteriole end. For example, we have hydrostatic pressure. Blood pressure, hydrostatic pressure inside the capillary is 30 millimeter of mercury. Plus 3 is interstitial hydrostatic pressure. It's in tissue. We count this together, and net hydrostatic pressure in the arterial end will be 33. And this 33, opposite for this hydrostatic pressure, will be colloid osmotic pressure. In blood, it's higher, 28, because albumins in the blood in the capillary is higher. And in tissue fluid, it's 8. Commonly, oncotic pressure in the arterial end will be 20. And these two things, two forces, they opposite. And hydrostatic pressure opposite for oncotic pressure. This we take oncotic pressure from the hydrostatic, and net filtration pressure will be 13 in the arterial end. For example, if this Y, and you see, if hydrostatic pressure higher than oncotic pressure in tissue, fluid goes to the least, yes, to the less resistance. It goes from the capillary to the tissue. This is why filtration happened here, because 33 is more than 20. It's more than force in the tissue. Understanding this? You hear me, guys?
Yes, teacher.
And if we go to the venal end, we can see the blood hydrostatic pressure in the venal end is less. You see, it means blood pressure in the venal end is less. Here we have in arterial end it's 30, in the venal end is 10 only. And other things they the same. And if we count, we see that hydrostatic pressure in the venal end only 13. But oncotic pressure in the venal end, pressure in the tissue, it's 20. It's more. That's why we have reabsorption here. This is why fluids from tissue go inside to the capillaries. And this is reabsorption. From tissue to capillaries, it's reabsorption. From the capillaries to tissue, it's filtration. Here in this is why in arterial end fluid go to the tissue, in the venal end fluid goes to the capillaries. You should know these hydrostatic and oncotic pressures, and again you can see it's connected because changing different blood pressure inside to these ends. For example, if you increased blood pressure in arterial end, yes, it is in arterial end, hydrostatic pressure will increase too, and it means it will be more than 30, and it means filtration increased, and it will be faster. Here, reabsorption will be stable, and if you increase blood pressure, it means filtration will be higher. If you decrease your blood pressure, the net filtration in the arterial ends will be decreased, and it means less filtration will happen here. This is how filtration and reabsorption connected with blood pressure. Understanding? You should understand how exactly increased or decreased blood pressure affect for capillary exchange because of blood pressure, because of blood hydrostatic pressure changing. Okay? Understanding this?
Okay, teacher.
Teacher.
Here. You should know that capillary reabsorb only 85% of fluid that they filter, and 15% absorbed by lymphatic system. Lymphatic system take this tissue and back to the venules also. You will read about lymphatic system, how or what is it in the next chapters when you discuss the vessel anatomy. Так, что это? Variations in capillary activity. Yeah, capillaries usually reabsorb most of the fluid they filter, except kidney capillaries. For example, in glomeruli, in the kidney, we have only filtration. Or in the alveolar capillaries, in the lung, we have only reabsorption. And this reabsorption prevents some liquid inside the lungs. This is two exceptions for this capillary exchange that we learned before. Yeah, here in the kidney we have only filtration. In the alveolar capillaries we have only reabsorption. Так, Fundamental cause of edema. Okay, here we should start to talk about edema. Edema. Do you heard about edema before?
Yes, of course.
What is it? What is it, edema? Who can tell me? What you knows about edema?
Is it connection of liquid in a loose tissue, for example? For it, a collection of the liquids via vessels in loose connective tissue.
Edema when you have some problems with filtration and mostly with reabsorption. It means if your reabsorption in tissue didn't work correctly, tissue will filling with fluid and it looking like edema. For example, do you see my screen?
Yes, teacher.
This one. You see its left. If we press, it's one of the example of edema when you can see easier. This is your leg, and if you press by finger, you see, we see your finger
Yes.
here. Again, if you press, you can see it's pressed way. It's edema. This mostly it's failure of the heart or the kidney that leads for these symptoms, edema. Yeah. Now we discussed what is it? Data. I need to back for my PPT. Okay, edema is accumulation of excess fluid in the tissue, and it occurs when fluid filters into tissue faster than it absorbs. It means when your absorption didn't work correctly. And we have three primary causes. First, it's increased capillary filtration, for example, kidney failure, histamine release, old age, or poor venous return. Kidney failure, it's because our kidney didn't work. It's our kidney not excreted excess liquid from the body. This is why it stay in the increased our blood pressure, increased blood pressure, increased capillary filtration that we discussed before. Yes, increased blood pressure, and it means more filtration, more liquid in tissue. Histamine release, because histamine also increased permeability of capillaries for filtration. Old age, because after some time, in old age, our capillaries will increase permeability for filtration themselves. And poor venous return. We will discuss about venous return mechanisms in the next lecture after 1 hour, but it means when your veins blood don't back to the heart normally, you also can see edema. Так, это убрать. Next, reduced capillary absorption. For example, hypoproteinemia, reabsorption. You see, do you remember we have filtration in reabsorption? If reabsorption didn't work, and we said that reabsorption connected with oncotic pressure. Yes, oncotic pressure is how connected with the proteins, mostly albumins. And we know that more. Ой, почему я не показываю? Вот here. We said that reabsorption connected mostly with this oncotic pressure. Oncotic pressure connected with the albumins. Блин, тут ты мешаешь. Oncotic pressure more in the blood, because albumin means more in the blood here than and less in tissue, and this why here oncotic pressure reabsorption work. But что это такое? But hypoproteinemia. Hypoproteinemia, it means less albumins in blood. If albumins in blood decreased, oncotic pressure decreased, and force for reabsorption also decreased. For easy understanding, again, we're back here. You see, 13 is hydrostatic pressure in the venous end. 20 it's oncotic pressure, and this reabsorption pressure mostly happen because of increased oncotic pressure, you see. But if this oncotic pressure decreased, if we have hypoproteinemia, for example, in blood, oncotic pressure will be not 28, it will be 20. It means oncotic pressure net COP will be only 12, for example. 12 and you can see 13 minus 12, it's only 1. It's not enough. It means no reabsorption here. You see this, and it means also that hydrostatic pressure higher than oncotic pressure. Reabsorption never happened in this end, and tissue bad filtration produced. It means water will go to the tissue, but never back to the capillaries again. No reabsorption, it means more liquid in the fluid in the tissue, and we can see edema. Understanding this one?
Yeah.
Or not? I hope you understand, guys, because it's important. It's the most most hard part of this topic. It's only about this filtration and absorption. Other things, it's very easy. And here, liver disease again. Liver disease. Why liver disease caused for a problem with reabsorption? Because albumins produced by the liver, and if we have liver disease, for example, cirrhosis, the proteins not produced, and again we have hypoproteinemia, and again no reabsorption or less here reabsorption. It depends of count of proteins. Dietary protein deficiency. Again, deficiency, less protein, hypoproteinemia, and again, less reabsorption. Severe burns. Severe burns, it's because we lost proteins from the body surface without the skin. And again, hypoproteinemia, right? But because of burns. And again, less reabsorption. And it means more liquid stay in the tissue. Kidney disease, because that some kidney disease allows proteins to escape, proteins go with urine, and this is why we again have hypoproteinemia. Okay, it means the cause of reabsorption is hypoproteinemia, but this one is different ways that can lead for hypoproteinemia. And the third primary cause of edema, it's obstructed lymphatic drainage. Lymphatic system is lymphatic vessels. It's another fourth type of vessels that we have, but we don't discuss about this in the vessels because they not connected with vascular system mostly. They not connected with capillary exchange. It's not connected with oxygen and CO2 exchange. That's why we don't discuss in this topic about lymphatic drainage. But lymphatic drainage, it's important because they return 15% of liquid that don't reabsorb in the venous end of capillaries, and lymphatic drainage goes and back to the venous circuit to the systemic circuit in the left venous angle here, in the subscapular angle here. And when you obstructed lymphatic drainage or you surgical remove them, it means this 15% of liquid stay in the tissue, and also it can be cause for edema too. Okay. Why edema is bad? Because excess liquid. Firstly, you saw, yes, you saw a video how it looking for the leg, and also bigger leg will bigger than normal. But edema calls for tissue necrosis because oxygen delivery and waste removal impaired. It means oxygen go to the tissue, but we see stagnation, liquid stagnation of waste in the tissue. They don't remove, they don't reabsorb, and it leads to necrosis. Also, if we have pulmonary edema, edema in the lungs, yes, it's a suffocation threat for us. Or cerebral edema, edema in the brain. We feel headache, nausea, seizures, or coma also can happen. And the last one, severe edema or circulatory shock. Because if you imagine every time filtration produced, but liquid go to the tissue, but don't back for the systemic circuit, it means less liquid stay in the capillaries, in the arteries, and blood pressure will decrease. And decreased blood pressure is shock. And it will, after sometimes decreased blood pressure will lead for ischemia in the brain, because liquid not enough in blood. We have ischemia in brain, and up to sometimes we can die too. Understanding? Guys, you hear me?
Yes, teacher.
Yeah.
This is why we should treat edema. And for example, if we have, if you remember the heart, yes, we have two parts of the heart, left and right, left ventricle and right ventricle. If we have failure in the right ventricle, we have edema in the systemic circuit. We have edema in our legs, in the liver, in the abdominal cavity, for example, in the systemic circuit. If we have failure in the left ventricle, in the left side of the heart, we have edema in the lungs. It's called pulmonary edema. It's one of the type of the disease after the infarction, for example. The patients have problem with respiration. And if you connect your clinical thinking, you understand if we have pulmonary edema, and it means we have liquid in the tissue in the lungs. But if you remember, we absent filtration in the lungs, in capillaries, because it's dangerous for oxygen and CO2 exchange in the lungs. This is why normally we have only reabsorption there. But if we have pulmonary edema, it means less gas exchange in the lungs. It means less oxygen. And again, you have ischemia in the tissue, not only because of edema, not only because of oxygen delivery decreasing, but also oxygen in your body decrease because you not have normal gas exchange. You see, it's like a feedback. It's again and again the decrease your body health. They connected with each other. The respiratory tract, the respiratory system, the vascular system, the kidney system. This why, for example, some problem with kidney can lead for edema. Some problem with oxygen, also with lungs, Also, if you have problem with the lungs, it also can failure your heart. And if you have problem with the heart, again, edema can happen. You see? Так, how much time we have? Okay, guys, our first ended. Do you have question about this lecture?
No, teacher.
Yes, teacher, no question.
All
Okay.
clear.
No
Thank
question,
you.
no.
If you understand, I will leave you earlier, but please connect to the second lecture, okay? It will be last lecture with me, and we will discuss about venous return. We will discuss about varicosity disease. And you remembered, yes, I am vascular surgeon and I know more information about varicose disease than your teachers, for example. And if you have some question about this disease, you can ask me in the end of the lecture, next lecture. Okay?
Okay, thank you.
Okay, teacher.
Understood.
1 hour. Bye.
See you later, teacher. Goodbye.
See you later.
Goodbye. See you.
Thank you, see you later.